When I started training, so I am an adult physician with an interest in pregnancy, there was not really a path for obstetric medicine. So I trained as an adult endocrinologist through a adult training pathway. And then along the way, I guess when I had my own children, I realised that there was a real need for an area like this, and I guess I came around at the right time. I did some training in paediatrics and training in obstetrics, and completed my training doing a PhD. And about 2 years ago, Women's Hospital and Ramsay Foundation put together this role of a Director of Obstetric Medicine to try and really bring this area forwards. I think we've traditionally had this idea that women who pursue pregnancy are all going to be fit, young 25-year-old women with no health problems, and I think that's just not the case. And I think we all know that women are pursuing pregnancy at an older age, but also women with really complicated medical problems. In the past, women were just told that they shouldn't pursue pregnancy, period. And I think now we've got a more flexible approach to that, and we want to do it in partnership with women, providing the best support we can, rather than it just to be a hard stop no. I really feel passionate about women going into pregnancy being well informed. So I don't see it as my role to say, somebody should or shouldn't pursue pregnancy, but for women to be able to make informed choices. And I think at the moment, a lot of the information we have is just based on consensus. So it's people sitting around in a room saying, what do we kind of think is the agreed area? And I feel like in all other areas of medicine, we have solid research, we have randomized controlled trials, or we have evidence to base our decisions on. In obstetric medicine, there's just not much evidence, and so we fall back on sort of opinion. So I really would see our research group as being leaders in putting some evidence into the field. And so when we have PhD students each exploring a different area, the goal will be to put down some solid evidence so that women can make informed decisions. And ultimately, of course, we want that to end up with healthy mum, healthy baby. And some women who are going to choose not to pursue pregnancy based on that evidence, and that's absolutely okay as well. I think unless we ask the question, unless we actually know what's happening in women's lives, one of two things were happening. Either women were not pursuing pregnancy, or women were just not receiving medical care and were pursuing pregnancy anyway. And then we were left with this problem where these women just, were not getting the best medical advice and were pursuing pregnancies in a really high risk way. So I think, we're a little bit more open-minded about how we do it, but we still want to get the safest, best outcome for mums and babies. So there's a real area. And to be honest, the Ramsay Foundation and the Women's Hospital have been really forward thinking in recognising the need and then putting in a position. And my role is to grow a research group and to grow a clinical group to support this need. So not just myself, but to a wider group. So we've got about 10 or 12 physicians, we've got PhD students coming through, and all are taking on a slightly different area to try and provide information in this area. Because there hasn't been an education pathway for obstetric medicine in the past, we are still in the process of putting together a pathway for training for young doctors and other health professionals who equally feel passionate about this area. And so part of the role and part of the leadership that Ramsay Foundation and the Women's Hospital have shown is in putting together a pathway for education and leadership for not just medical people, but allied health as well. And I think, the foresight that Ramsay has shown in supporting this area in terms of research and education is really quite outstanding.